Grand River Hospital has worked hard to deliver high-quality care to residents of the Waterloo region and beyond. We're building new facilities, launching new quality improvement programs, and making sure our patients have the best access to acute health services.
Grand River Hospital is a major player in the community's healthcare system, so we have 14 major clinical programs and services that we deliver for all of the residents for our community. Our role is to provide those services, but also to connect with our community partners so that each patient gets the care that he or she needs before, during, or after a stay with us at Grand River.
We'd like to introduce you to Grand River's 14 clinical programs and services and tell you about their achievements. We'll show you how your dollars donated to the hospital through the Grand River Hospital Foundation are at work. We'll also tell you how we're doing more to continuously improve the quality of care we provide. Grand River provides care throughout the lives of our residents. Here's how each of our programs helps improve health and quality of life for patients and their families. As Kitchener-Waterloo's Centre for Maternal Child Services, Grand River Hospital provides care for thousands of new families every year. But nearly 20% of KW residents don't have a family doctor. Grand River nurse practitioner Rita Kudajar helps expectant mothers, providing them with health services they need as they prepare for birth.
Without a family doctor, it makes it very difficult for them. Being able to help them gain confidence and make informed choices is really important for them, and it just gives me a great pleasure seeing them develop and grow and prepare for a newborn baby and make healthy choices.
Grand River Hospital's childbirth program is one of the busiest in the province. The hospital cares for over 4,200 newborns and their families a year, from pre-birth to post-birth. GRH was awarded a World Health Organization baby-friendly designation, which supports breastfeeding for new moms. And families have given the hospital excellent satisfaction ratings due to the high quality of care. Our achievements in our children's and neonatal intensive care programs are one example.
The most important thing for us is to be able to keep our families and the babies closer together. We want to keep that family unit together as much as we possibly can.
To do so, we've added 2 new specialized beds to our neonatal intensive care unit, bringing the total to 22. We've also started a clinic to monitor developing retinas in our premature babies. Now, trained nurse imagers partner with an eye specialist at McMaster Children's Hospital to do the exam right here. Our emergency program is vital for our patients.
At Grand River, in our emergency department, we see approximately 50,000 patients a year. We see a lot of patients, from minor treatment patients from a stubbed toe, sore throat, headaches, that sort of thing, to major injuries. We're the trauma center for the region and work alongside with our critical care programs and surgical programs to treat these patients. And we also have highly skilled response team.
We're working hard to reduce emergency department waits. We've hired more nurse practitioners to help in minor treatment cases, brought in specialized nurses to help manage the needs of elderly patients, and worked more closely with partners like the Waterloo Wellington Community Care Access Center to help patients receive care and return home when they're ready. Raising the bar and caring for families, that's what we do best.
We're establishing standards to basically reduce our infection rates. We would like to see it at 0. Patients are benefiting from the new set standards for central lines because they are spending less time in the intensive care unit and they're not developing infections from the line. In the ICU department, we do save lives, but in those circumstances where we can't, we have an end-of-life team where we work to support patients, family, and ICU staff during patients' final moments.
Grand River Hospital is a supporter of 2 major programs to help critically ill patients. We partner with Trillium Gift of Life Network, Ontario's organ and tissue donor registry, to support the transplant process. And we recently joined Canadian Blood Services Partners for Life campaign. We want to support our patients' ongoing need for blood products through donations from our staff. Providing care means reaching targets and setting new standards.
Grand River Hospital is able to provide surgery for patients who have fractured their hips within 2 days of injury. That is among the best in the province, and that is also really important for our aging population. Another success at Grand River is that we've implemented the surgical safety checklist in collaboration with St. Mary's General Hospital. Patients benefit from the surgical safety checklist in that all members of the team are able to communicate relevant information for that case to improve their safety and the overall outcome of their surgery.
Thanks to donations to the Grand River Hospital Foundation, GRH is upgrading several of its operating rooms. The rooms are larger, more efficient, and feature a range of high-tech upgrades to provide better patient care. Part of the medical program includes our role as a stroke care provider.
About 50% of the patients admitted with strokes will have difficulties with their swallowing, and that can lead to increased risk for developing chest infections. Grand River Hospital and the Speech Language Pathology Department has developed a screening tool called the Stand that the nurses can use after hours and on weekends to determine whether a patient is ready to start eating and drinking and taking their medications by mouth.
Many seniors need to think about where they'll live as their health changes, but choosing where to live while in hospital isn't always the best way. We're working with our partners to apply the Home First philosophy in discharge planning. With community support at home, seniors get the chance to go home and recover from their illness before they decide where they'll live. With ongoing visits and help from community partners, patients continue to have the support they need at home while they decide where they will live. At Grand River, we're doing more to detect cancers earlier with our diagnostic assessment programs.
I would identify the major benefit of the diagnostic programs in terms of access and speeding that time interval between the initial consultation or the initial symptom or abnormal laboratory test that cause concern to getting patients into the operating room appropriately after due diligence. We've been able to shorten that time substantially with the diagnostic assessment programs. A woman spent approximately 111 days from the time of an abnormal physical examination or abnormal mammogram until the time she got to the operating room for definitive surgery for breast cancer. And that has been reduced to 35 days with the breast assessment unit. So that's a huge benefit. But the other benefit is, of course, quicker treatment for cancer is always better than later treatment in terms of effecting cure and control of disease.
The Grand River Regional Cancer Centre provides excellent care to patients in Waterloo, Wellington, and beyond. The Cancer Centre has provided care in nearly 167,000 visits, and wait times to access care at the centre are among the shortest in the province.